I've had conversations around blood for a while, and I recently learned, only last year, that your blood, yes, that drop that comes out of you when you get a wound or anything, has parts. For the life of me, I would just have said, look, it's just blood, it's red. But then I've been told that it has at least 5 parts. Well, one of them I have seen in our conversation, next conversation, about platelet-rich plasma therapy in regenerative medicine. I have no idea what that means, but hey, I have a fair idea. When you hear platelet, you may not know, but I'm telling you now, as the professional, that is from your blood. But sorry, you can't extract it yourself. And then you hear regenerative medicine. You're wondering what all of that means? Well, 3 people are here with us this morning to talk about regenerative medicine. Mr. Morakinyo Oguntoyinbo is with us this morning. Thank you so much for your time.
Yeah.
And we also have Dr. Amadine Osayomore, co-medical director, as well as Dr. Rory Williams. Thank you, gentlemen, for joining us today. Now, let me begin with you. What are we talking about here?
We are just talking about regenerative medicine. That is something that just came out about 5 years ago, and we brought this in the system in our country. I have a team of doctors here, Dr. William, Dr. Amadi, and one of our doctors is not able to be here, but we next time Dr. Oladmeji. They will be joining us later. They will be able to talk and explain to our public about
what's the objective.
The objective is just to, revitalize the blood and make them more younger. But they will be able to explain better when the question is to
okay. Let me ask you then, Dr. Osayomore. Let's start with that platelet part. I hope I didn't talk out of point.
No, I think you're pretty spot on. Essentially, you're right. The body has everything that is simple, but kind of complex. It has parts, and different parts do different things. When you combine the ability of the body to heal and regenerate means to bring something back to where it was before, regen. So the idea is to try and take constituents and apply to specific areas that are deficient or faulty and get them back to, we cannot always get you back to 100% in anything in this world. It's a fallen world. But we can get you back to at least better performance wherever you were in now, where you are now to where you were before. So that's kind of a baseline idea.
And but then you also talk about the therapy part of it, Dr. Williams. Platelet-rich plasma therapy. All the therapy so many people watching you right now knew was just to massage and all those other little things. What are we talking about here?
Well, the idea is to concentrate your healing factor. We're trying to re-heal you. Before we give you medicines, when medicine doesn't work, then eventually, sooner or later, you might require maybe surgical intervention. So this idea now comes to avoid the extremities of surgery and rejuvenate the tissues to reclaim some of the performance. And so you take the healing factors and concentrate the healing factors in the certain area that needs treatment. So we could use your natural body's abilities, concentrate it, and now enhance the healing.
So if for this particular conversation, exactly what would you say that we should be focusing on? I see that the target conversation this morning is joint pain and ED.
Yes. So for erectile dysfunction, you have, as we went through, you take medicines, after a while the medicine does not work because you're aging and the tissues are going down, so the response is going down. So now the next idea is how can we get you to respond to the medication or does not require medication. So by revitalizing the tissue of your body, we get a response and using a natural process, just enhancing a natural process to get there.
Okay. Dr. Osayomore, the kneecap part. Is this whole regenerative medicine thing for those who are aging?
I think well, these days, well, I would say yes, and a bit more. The population is, we're all adjusting our diet, so we're getting older quicker, like your past guest just talked about. So, but primarily, it's for anybody who is not performing at their best. I've had, I was just telling my colleague about an 86-year-old I saw some time ago who is more spry than many 50-year-olds.
Wow.
So that person might not necessarily, you know what I mean? So it's age, yes, because more of the older people need, they have problem with ED, have people with knee joints and stuff like that. But you could be surprised where you find where you can need the services. Yeah.
And in terms of when you ask about age, you know, one of the earlier fields that started regenerative medicines were the young athletes that had injuries. Supposedly a 25-year-old basketball player or football player, he has an injury and they do surgery. Many times when they do the surgery, they lose the athleticism. So they're trying to find a method of not having surgery, because surgery, sometimes you have to destroy good parts before you can get to treat the problematic area. So this therapy was done in early 2000s. Actually, there's a famous basketball player named Kobe Bryant was a very big advocate of this therapy. And so because he wants to avoid surgery, because the implication at that time, surgery sometimes rob these young people of athleticism. So this was where it was still very much in an experimental stage at that point. So at this point now, he was able to prolong his career. He had a 20-year career, which is very good for a basketball player. And it avoided surgery, so he maintained his athleticism. And now we find, what we are now doing now is that we are finding other organs to see. So like erectile dysfunction, you know, unfortunately, once you have any surgery at that area with erectile dysfunction, it will never get, many times, it will never get back to the natural process. You'll always be required of, at that point, an implant to function. So this process, when you're able to revitalize the tissue, you're able to do at times, surgery can be very traumatic, so avoid. And then there's also a healing aspect after surgery, that many times you do a surgery, you can't just get up the next day and go. You have to go through weeks of rehabilitation before you get. So for instance, the knee, when you go and you do knee surgery, the downtime for the knee surgery is 6 months to a year, meaning you do the surgery, you at least have to stay off the knee for 4 to 6 weeks. Then you start to go strong physical therapy before getting there, before being functional. And even at that point, you go through a lot of pain, a lot of rehabilitation to get to a point where it's functional, but not quite close to where you could get to. This method avoid going through the surgical process. I'll also give you another, now that I'm on the knee, medicines. A lot of times if you have knee pain, we take paracetamol, we take ibuprofen. Now the person is aging, they continue to take ibuprofen. And for instance, ibuprofen, if you take it too much, it's very good medicine. But if you take the medicine too much, it affects kidney. So you take a medicine short times, very good, but people have arthritis. Every day, every step, it's painful. So the idea now is that if you are able to treat the knee without requiring as much medicine, which eventually over time will have its own side effect, as well as your aging body, aging organ, it has a better outcome to let you live longer. And so that's the approach that we go from. First, it used to be medicine, stronger medicine, and then surgery. Now what we're getting to now is that we do medicine, obviously, and then if the medicines are not as effective, then you could now try to rehabilitate the tissue. So if we were young, we start out at 100%. And as lives go on, we start to get down, so you get to 20%. If we can get you back to 40, 50%, that would definitely buy you a lot more pain-free years. So no problem walking after.
Okay, let me come to you, Dr. Sayamare. Is this only about surgery? Is this whole therapy is subject to, is this a condition after surgery or an alternative to surgery?
Well, we'll prefer, nobody wants to be caught with a knife if you can avoid it. That's just, whether it's being
Except
done.
it's in the kitchen.
I mean, it was in the kitchen. So I would say it's meant to not help as much as possible keep you from the surgeon's knife as long as possible. Like Williams was saying, if I can get your knee back, if all your cartilage is almost gone, everything is compromised, and we can start to give you this therapy and see if we can get some things back in order, then you don't need to go under the surgeon's knife. If you're dealing with stuff like that, I would just say the important thing is the therapy, as much as possible, delays or potentially keeps you from going under the surgeon's knife. Because if you are regenerating something, then you don't need to go start cutting things about. Okay. The surgeon will come and cut. We need to do that.
Okay. So someone told us earlier about the fact that even 18-year-olds or even younger are now having hypertension, high blood pressure. For the life of me, my dad would cringe in his grave at that possibility. Is this also something, does that also relate to young people?
Yes, exactly. And one of the remember, sport medicine and the orthopedics that works on the bone and tendons were one of the earlier people to actually use it prior to surgery or even after surgery or during surgery. They will implement some of these processes to enhance the healing process. The starting out of this whole regenerative medicine was actually performed by surgeons and doctors that were having issues after they do a surgery, the wound wasn't healing. And so they need to find a way out to get the wound to heal. And so they were one of the first implementers in the early 2000s with this process. And now it's growing where we're trying to find other areas where it can help.
All right, well, you can't but have a thing or two to say, Mr. Oguntoyinbo, to all of these things. What is the interview? The first thing perhaps is awareness of the need by the people, right?
Yes. So we just want people to be aware, and they can always check us out on our website.
What's the website?
wprimemedical.com. And our office at 106 Ogunusi Road, Ojodu, Isheri, Ikeja, Lagos. And they can always reach us. But you check our website, you see all our information there, and you see all what we do, erectile discussion, all those kind of things. And if you need help, you can always reach out, and we'll see how to help you. Our phone number is also there.
Well, thank you so much for your time this morning, Dr. Moraki Oguntoyinbo. Of course, that's the website you're seeing on your screen right now, and the website is primemedical.com, right?
Yes.
Primemedical.com. Just go there now, you'll be able to find some information.
Infertility also. Well, the expert, doctor, one of our doctors we are talking to is going to join the team very soon, which Dr. Oladimeji, but we are talking to him for those who have problem in infertility for female even couples. And we also do that.
Absolutely.
But hopefully, maybe in our next visit, Dr. Oladimeji will be here to also explain better on that.
Again, the website is wprimemedical.com. That's the website right there you can go to for all that you need. Moraki Oguntoyinbo, Executive Director, thank you so much for your time.
Thank you, sir.
Dr. Amadine Osayomore, Medical Director, as well as Dr. Rory Williams, also Co-Medical Director at W Prime Medical. Thank you, gentlemen, for your time this morning.
Thank you very much.
Thank you.
Thank you, sir.